o'clock, which is the start time for our program, so we will move forward. I have Allie Orwig on. The Indiana Rural Health Association hosts the Zoom platform for the FQNC meetings. And so, Allie, if you would like to maybe go over some housekeeping items before we begin the program.
Sure, thanks, Becky. Just a couple quick items. As most of you know, we do appreciate it if you mute your line if you are not directly asking a question or responding. You can do that by hovering over your name if you are looking at the participant list, or by hovering over the screen, and then some options should pop up for you either at the bottom or the top depending on how your computer's set up, and you should be able to navigate to the mute button pretty easily. We can do it manually, but then it makes it more difficult for you to ask questions later. And then the next thing would be that if you have any questions that you want to ask during the presentations, there's also a chat function that you can utilize on the Zoom feature. I will send everybody a quick chat so you can see how that pops up. If you send those to either myself or Becky Royer, who is listed as R. Royer, we can kind of moderate those during the call. And then as most of you probably know, we do record the session and we'll be sending it to Becky later to share with you.
Great, thank you, Allie. Again, the presentations for today's program were sent out Sunday evening, so you can locate those in your inbox Sunday of this week. Our spotlight presentation today is by Becky Sanders with the Indiana Rural Health Association. Becky is the Director of Operations there at IRHA, and she works with a wide variety of healthcare providers throughout the state, which most of you know. I know several of you have worked with Becky directly. She also serves as the Program Director for the Upper Midwest Telehealth Resource Center. And in that particular role, she works with the consortium partners to provide a single point of contact for telehealth resources throughout the states of Indiana, Illinois, Ohio, and Michigan. So we're very lucky to have her here locally to assist us. And the Resource Center provides educational presentations, individualized technical assistance, facilitation, and connections to telehealth information via the website and program staff. So at this time, I will turn over the presentation to Becky.
Thank you, Becky. I appreciate being able to join your meeting today and present on this topic. So today we're going to talk about virtual health and the culture change that's involved in starting a telehealth program at your individual facility. So some of you that have been in the workforce since the 1990s might remember the book Who Moved My Cheese by Spencer Johnson. This was a very popular book to talk about change management theories. So we're going to use his characters today to talk about this briefly. So the 4 characters that we're going to talk about that are focused on in the book are him, who's a stabilizer, Scurry, who is a producer, Haw, who is a unifier, and Sniff, who is an innovator. Further analysis has been done on these profiles for different personalities in Lex Sincy's book. And so we see, let me go back. So him, our stabilizer, he's always focused on how are we going to get this done, and allows for analysis. He likes to know all the nitty-gritty stuff. Works at a slower paced, more structured approach. And then our producer, Scurry, our producer, focuses on what are we going to get done? What is it we're going to do? He wants to go fast, and he has a really short view of what's going on today, tomorrow. And he likes autonomy. He likes to work individually, not necessarily with a team. And then Haw, our unifier, focuses on who's going to do it. Well, this is your job, and this is your job, and this is my job, and wants to talk about the process of how things are going to get done there, or who's going to do what. And then innovator, Sniff is our innovator, and he focuses on why not. He's very excited about getting things done and very focused on the long-term view and very results-oriented. So when we develop a telemedicine program, there's 3 basic tenets that we're going to talk about today. Assessing and defining the program, developing and planning the program, and implementing and monitoring the program. And really, if you think about it, another change management theory is the plan, do, check, act cycle. And this is very similar to what we're going to talk about, these 3 tenets today. So assess and define is the first tenet. So anytime you start a new program, you need to assess your needs and your environment. So what does that mean when you're talking about a telehealth program? So my first question to organizations is, do you have a telehealth champion? Do you have someone within your organization that is passionate about doing this project? And then is there a corporate willingness to develop the program? Because if there's not a corporate willingness and that champion doesn't have the time or financial resources to do what needs to be done, then the program's going to be dead in the water. So as you think about a program, so think about what healthcare services you don't have in your organization, and you need to identify and prioritize what appropriate resources and services that you have. Also, you need to identify the assumptions and constraints. If you have an assumption that you're only going to have telehealth visits once a week on certain hours, then you know that that's, if it's a 2-hour window and you schedule 15-minute appointments, then you're only going to be able to take 8 appointments via telehealth in a given week. So as you start to develop your plan, you need to figure out what your program model is going to be. Where are the patients that you're trying to serve, and which services meet those patient needs? What technology do you need? And what's the best organizational model? So do you have the human resources to get this up and running? It's going to take a lot of coordination. Anyone that's been involved in some of the lean programs that Purdue has done, the very different organizations have done around the state or hosted, you know that you need an interdisciplinary team to make something like that work. And a telehealth program is very similar to that. So what facility resources do you need? You're going to need, somewhere to house the patient, so electricity in the room, broadband access, a HIPAA-compliant video conferencing platform. Sometimes other equipment is needed. And who's actually going to provide the service? Or do you have a physician or a nurse practitioner or a physician assistant that is going to provide the services? And you could also contract with a third-party entity. There's a lot of those out there in the telehealth environment as well. What about legal or regulatory constraints? Do you have to think about credentialing, licensing, getting a provider credentialed at your facility, legally able to provide services at your facility? And then what's your implementation approach? Do you want to start with a phased approach, which is what I recommend? Depending on the services that you choose, you might start with a specific population as far as insurance populations, because the billing and reimbursement for telemedicine is really driven by the insurance of the patient. So you might start with a Medicare population or a Medicaid population or pediatric population, depending on what service you want to offer. And then what is your business case? You're going to have to get this approval from your CEO, your CFO, possibly even your board of directors. So a great place to get data is from your community health needs assessments. Now, I know hospitals, critical access hospitals in particular, have to do these every 3 years. So you go back and look at your last community health needs assessment. You might do focus groups in your community. And then also think about the mission. What is the organizational mission at your organization, at your facility? And does this proposed program meet with that organizational mission? So you're going to have to obtain financial equipment to implement and sustain this particular program. So what are your outgoing costs going to be? You're going to have startup costs and operating costs. And think about the soft costs too. Whoever is working on this, their salary is going to be involved and tied up in this particular program. Revenues, I mentioned reimbursement, so you need to think about the payer mix And is the project sustainable? So you want to pick a payer mix that's going to help you to sustain your project. And then you want to track your savings. You want to be able to have a base point and then move on from that base point and then be able to look back and say, you know, as of December 1st, 2018, you know, we had X number of patients per month for this particular group of patients or this particular diagnosis. And then, you know, what is that 3 months going forward, 6 months going forward? So things that you might want to track for a telehealth program include physician travel. If you've got an urban physician coming out to a rural site, patient travel miles. If you're referring your patients to an urban center and then you're able to keep them local, what patient miles are being saved? Also, you can track effects on the economy of your local community. Are you able to keep that patient local, and any labs or ancillary costs, are those staying local too? Is that additional revenue in your organization? And effects on the environment. The travel that you're saving, you could calculate average gas costs and emissions saved for the environment. So back to our 4 characters here that we're talking about: hem, scurry, haw, and sniff. Within each of your organizations, as soon as I put these on the screen, I'm sure that you thought about some of your coworkers and you're like, oh yeah, that's haw, oh, that's sniff. So as you think about starting a new program and the culture change is scary. Nobody likes change, especially when it's forced upon them. So that's why you want a telehealth champion to bring that more of a grassroots approach to your new program. And you want to assign roles and responsibilities based on the personality traits that you're working with on your teams. So this is part of our planning. So we need to figure out what our objectives are and what are the roles and responsibilities of the different team players, the team members, and the team leads. And then how are you going to market it? I mean, you could have the best program in the world, but if you don't have a marketing strategy to reach out to your patients, they're not going to know about it, and it's going to flop. So you might do local newspaper ads, you might do TV commercials on a local TV station, you might do direct mail, or even social media. And for policies and procedures, just go back. I do not recommend totally rewriting policies and procedures. I would say look at your existing clinical guidelines, your existing policies and procedures, and maybe inserting a sentence or two here or there about telehealth and about the program and how you're adding technology to that service that you're providing and how you're going to do your scheduling. That's all you really need to do. And there's no really good standards out there. I mean, you want to follow JACO or whatever kind of credentialing auditing that you do in your organization, but it's really what's best for your organization, what's going to fit your organizational needs. And then it's all about process integration. So when someone goes to room a patient in a clinical room, maybe you guys have little folders on the outside of the door. You have little things that you flip so that the providers know where they're going next, that type of thing. So how is that going to integrate when your provider's not in your facility and they're, 30 miles away, 50 miles away, wherever they're at? Is there a text message that the scheduler uses or that the nurse or other clinical person that's rooming the patient uses to contact the provider and say, hey, the patient's in the room and they're ready to see you? Those are all things that you have to figure out. And then equipment training for the staff. Whoever's rooming the patient's going to turn the equipment on, make sure it's ready to go. And then again, as you continue to work your plan objectives, you think about where the space is where the patient's going to be. If it's just a single patient seeing a provider, you probably can put them in just a generic patient room. It has to have broadband access, and it has to have the software and computer that you need to run the service. So here's where you really want to look at what is your internet access at your facility, and what is the SLA, or the service level agreement. If there's a bad storm and power goes out, or for in worst case scenario, you lose your internet access, what's the plan with your internet provider? Do they have a 2-hour or a 4-hour time that they're going to get you back up to speed. You know, do you have a backup generator? You know, all of these things come into play. Do you have a little hotspot that you can run wirelessly and make it run if something goes down? And then interoperability and scalability. One of the biggest things that I hear about today is folks trying to integrate their telehealth programs into their electronic medical record system. And that can be a bear, depending on what system you've got and what modules are available to you. That's a real process that has to be thought about and thought out carefully so that you can do your due diligence with your documentation for your patient outcomes. And then organizational approval. No one works in an island, although we sometimes might wish that we did. You're going to have organizational approval for your program. So you're going to make sure that you go through those steps to get organizational approval. And then lastly, what are the outcomes? What do you propose to meet? What are your project goals, objectives, and outcomes? And how are you going to track them? You want to measure, track, and achieve those outcomes. So in order to do that, you have to figure out what you're going to track. Are you going to work on volume? Are you going to work on quality or clinical objectives? And then as you go through and you actually start implementing your program, every once in a while you're going to take a step back and check what the data that you've been tracking. Do you need to tweak a process here or there and do a course correction? And then improvements. There's always room for improvement. So once you have a defined plan and you're implementing it, you can always go back and test new things to add to the process to help you manage it. So all of these steps, you really want to have a work plan. And this is just an example work plan. If we were doing this particular session today, face-to-face, or actually in person, I should say, because we kind of are face-to-face. But if we were in person, we would go through this if we had more time. But you want to think about each one of those things. And as you write your goals, remember the acronym SMART. So up in the upper right-hand corner of the screen, you should see SMART. Each goal and objective needs to be specific, measurable, achievable, relevant, and timely. So again, back to that implementation. 3, 2, 1, go. So you've got everything, you think you've got everything in line. You start the program. As you go through it, you identify any risks, you mitigate those risks, and keep evolving the program and tweaking it to be better. And then as you're monitoring things, you need to make sure, are things really going as you thought they would go? Are there things you didn't even think about that you need to modify your plan to include? And are you really meeting the objectives of your program? All of those things are to be considered. So that, again, that's all part of that plan, do, check, act cycle. I'm going to spend just a minute or two on the telemedicine room design. We talked about an individual clinical room, a patient room. So the location and size of wherever it is that you're rooming the patient is really going to depend on what type of service is being delivered. What kind of equipment that you need, and furniture, electricity, broadband. And something that you might want to consider is the lighting and the acoustics and the color of the room. So the room, you don't want it to be on a busy corridor because you're transmitting information and you're using electronic microphones. You might even be using digital stethoscopes or otoscopes, those types of things. Lighting is important. You don't want to have the patient right by a window where they're going to get a lot of glare, especially if you're doing dermatology. You want a really good soft light or daylight example for the patient, for the provider to see. So also types of equipment. It's really going to depend on the service that you're providing. If you're doing diabetes education, you may not need to be in a clinical room. You might want to be in a conference room so the diabetes educator can speak to a whole group of patients at the same time. So there you might need conference room seating. You could be doing specialty consultations where you need exam tables. So again, I've talked a lot about an existing patient room. This is practical, and you're not going to spend a lot of money on new equipment here if you room the patient in that room. And one thing to think about is normally there's 2 chairs for the patient and the family. in a clinical room. So when the provider beams into the room virtually, you need to make sure that the provider is aware that there's the patient and however other many family members. So depending on how the camera is rotated, so the provider can see who all is in that patient room that they might need to address and take into consideration. So on the remote clinician side, on the provider side, they probably just need a desk and a computer, a webcam. A lot of times webcams are built into computer monitors or laptops or tablets these days. But consider that viewing angle again, so the provider can know who all is in the patient room that they're talking to. Same thing with the clinical room or classroom setup. All of these things need to be considered. And then really you want a very clean and uncluttered view for the camera. I have 2 monitors on my desktop today. I've got my webcam on top of the monitor, one monitor, and I've got all my Zoom windows and stuff over here, and then on my second monitor over here. So when I glance over here, I'm looking at my presentation, and I've got that on a different monitor. So wherever the provider is looking is very key. You want to have good eyesight. Right now I'm pointing towards my webcam, so I'm looking at my webcam as I'm talking to you today, so that you think, and I am, talking directly to you. Now, if I'm looking at my presentation over here, and all I'm doing is focusing over here, that's not a very good physician or clinician patient relationship. Doesn't look like I'm paying attention to the patient. Or if I'm looking down here at my notes all the time and not looking up, the patient's going to think that the physician or clinician is not paying attention. So just, there's a couple examples I've kind of shown you with my own movements, but an example of a provider that's looking down and not really looking at the patient. And then now she's looking a lot more at the patient. Acoustics are important too, because we're using microphones, so it's going to pick up sounds around. If someone was running the lawnmower outside I have a window over here. If someone was running a lawnmower out there, that would be distracting noise. High ceilings and hard surface floors, which we have in a lot of clinical settings, can create echoes. So that's something to think about. You can put sound insulation on the walls. You can carpet the room. Lots of other things to think about that you can use. There's even sound dampening paint that you could actually put on the walls. And then lastly, I want to give a plug. We are going to do our own Upper Midwest Telehealth Resource Center conference this summer in South Bend, Indiana at the Gillespie Conference Center. It's right between St. Mary's and Notre Dame. We are currently taking speaker proposals. If you guys have been doing a telemedicine program and have success stories to share, we'd love to hear about it. We'd love to share those at our inaugural conference. That link is going to be active, and we're taking speaker proposals until the end of this week on November 30th. And I'll send Becky Royer that link so she can send that out as well. So that's all I have today. I think I do have just a couple of minutes for questions.
Great. Thank you, Becky. A couple of questions that have been emailed to me is if our team would like some technical assistance from the Upper Midwest Telehealth Resource Center as we work with our committee, do we contact you directly?
Yes.
Okay. And I'll make sure and share your email when I share the other links and follow up from today's call. The other question is, you talked a lot about the environment to provide telehealth. Are there any general tips on using telehealth in the emergency room to promote success?
Mm-hmm. I don't have anything that I can think of right off the top of my head. In the emergency room, you are going to have a lot of noise. You're very rarely going to be able to take the patient and put them kind of in a soundproof room. So you're going to have to combat that. Best way to do that is to make sure that you have good quality microphones, maybe even headsets for the staff that's with the patient to converse with the remote clinician.
Okay, great. The other question that came in is, do you have any tips sheets or virtual practice sessions that are on demand to assist providers in providing telehealth services effectively?
Tips and sheets, absolutely. And that's one of the reasons I did my browser the way I did. So you guys should be looking at, as I open a new tab, on my computer doesn't want to play nice. On our website, on the Upper Midwest Telehealth Resource Center website, we have a whole ton of electronic resources available. Under resources here, there's sample templates, getting started guides, stuff about credentialing, grant resources, payer reimbursement. There's a whole ton of stuff there, sample forms and templates. And then, as I didn't really mention this in my presentation today, but you can also go to telehealthresourcecenter.org, and I can send you all these links to send out. And that's the National Telehealth Resource Center consortium. So there's 12 different regional telehealth resource centers. So I'm one of 12, and then there's 2 national centers. There's a policy center and a technology center that we refer to. As this gets loaded up here today, I think I'm going to need to reboot my router. So you can go on this site here and find your telehealth resource center. You see the 4 states here in lilac that we cover for the Upper Midwest Telehealth Resource Center, and then all the other regional sites. And then you can go to the National Center or the National Policy Center or the National Technology Center. And again, here there's resources. There's all kinds of fact sheets and guides and checklists and templates there.
And Becky, one of the questions that came in was examples of marketing to share. Wondering if you had any. That is listed on here as well, some examples of how others have marketed their programs.
No, I don't think so, but I'm certain that we could gather that information for you.
Okay, great, great. The one last question that I had come in here is, if you had to choose one area of focus for telehealth to build your program and maximize the use of telehealth services, what do you see being used the most in the 4 states? Mm-hmm. So I guess that's kind of 2-part. If you had to choose one, and what are you seeing it used the most for in the 4 states that you represent?
Mm-hmm. So in my opinion, what I see the most is behavioral health. There's a huge focus on behavioral health right now with the opioid crisis and substance use disorders. And with that particular service line, all that you really need is a HIPAA-compliant video conferencing software, because you're not really worried about taking vitals, blood pressure, weight, heart and lung sounds, all of that. So it's most cost effective. That's really a low-hanging fruit. Other areas that we hear a lot about today, school telehealth clinics. The Rural Health Association has a program where we have telehealth clinics in different schools. They're actually doing a ribbon cutting ceremony in Logansport today. And then, there's a huge focus right now on maternity health from the governor and the first lady. Or I'm not the first lady, the lieutenant governor, sorry. I just went to the Labor of Love conference a couple weeks ago, and just a huge push next year on that. So maternity in rural areas and lack of official OB units in rural hospitals. Diabetes and chronic care management are always really popular just because of the incidence of those.
Okay, thank you. I think that was very, very helpful. Mm-hmm. Okay, I'll just double check. Allie, did you have any questions come to you?
I did not.
Okay, all right. Well, thank you very much, Becky. We appreciate it.
Becky, I think you muted yourself.
Is that better? Can you hear me now?
Yes.
Okay, we were getting some background noise and I thought I unmuted myself. So thank you so much, Becky. Really appreciate it. We will send out the resources to everyone after the call. And if there are any other questions that anyone has after the call today, let me know and I'll connect with Becky and we will get the answer for you. So thank you so much.
You're very welcome. Thanks for having me.
Okay. Next on our agenda is David Conrad, the Flex Coordinator at the State Office of Rural Health at the Indiana State Department of Health. And so, David, at this time, we'll make sure that your line is unmuted and if you'll share your presentation.
Hey, Becky, can you hear me?
Yes.
Perfect. Alrighty. Just getting this set up. Okay. Sorry about this. I've not had to share my own screen before. Just looking for the way to do it.
Just hover at the bottom of the screen, David, and some options should pop up for you. Or if you're in full screen mode, I believe they'll show up at the top. You should see a green share button.
Perfect. There we go. How's that working?
Looks good.
All right. So I just want to thank everyone for being here today. I'm just going to run through a couple slides with some updates, talk about a few things that are coming up and a couple of other things to pay attention to. So this is mine and my coworker Abby Garcia's information here at the State Office of Rural Health. We are always available if you need to reach out to one of us, and if you have any other questions, and if you need something and we can't answer it, we're always happy to get you in touch with someone that is able to. I wanted to call attention really quick to one of the upcoming reporting deadlines that we have. January 15th is when we're going to have the emergency department transfer communication stuff coming through. This stuff is going to be sent through Simplicity or a secure email to Becky Royer. Either one. If you have any questions about getting this stuff submitted in, Becky is an expert on this area and always happy to help. So if you want to reach out to her or to me, we can make sure to help you out in that regard. So we've got a couple of different projects going on right now, and the first one I wanted to bring up is we have a swing bed benchmark initiative that is going on right now. So at the start of this cycle, I was talking with Becky, and one thing that we wanted to do was something focusing on swing beds. It's becoming a bigger talking point at the national level, and so we really wanted to see if there was some way we could do something to help out in that regard. So Valiant Health with Becky is partnering with Carrie Dunning to basically bring some information about this, kind of like general education around managing swing beds. And there'll also be some times that we'll be working with the critical access hospitals individually. The webinars themselves are going to bring everyone together, and we've started those. We've had one now, but you can hop into this program at any time. You can be as active as you would like to be, and we really just want to encourage everyone to try and get as much out of it as you would like. So if you have been thinking, oh, maybe we can do something more with our swing beds, maybe we can do something different, or if you're just interested in being involved and trying to find some benchmarking data, we know at the national level they're really looking at potentially adding some measurements in regards to swing beds. There's just been some information published where people are underutilizing them, leaving money on the table, and so they're really looking at making this something that will become mandatory in regards to reporting for critical access hospitals. So we're just trying to stay ahead of the game and help you guys out at the same time. Also wanted to bring up this really fast. We know that the influenza measurements have been dropped from InbeQuip, and so it's not going to be mandatory to report them anymore, but it is flu season, so we wanted to just make sure to include a couple of resources for you. Everybody's generally very good about this, but it just never hurts to have as much information as possible. All right, so we just had one of our critical access hospital convening meetings, and it went really well. Each time it's grown a bit. This time we had it hosted at IRHA's office here in Indy, and once again we offered a travel stipend for any hospitals that were coming. We just really kind of want to keep encouraging this, keep pushing this. I wanted to make sure that you all knew that the next meeting was going to be coming up on May 16th, and that'll be this coming year. We tend to do them twice a year. So far, that's how it's been. And each time we host one, we'll ask questions at the end about how it went, things that people are interested in, and that will guide the focus for the coming one. So we're just getting ready to kick off planning for the next one. So if you have anything that you'd like to see talked about, or things that you're curious about or would like more resources on, please reach out to us, let us know, and we can see if we can't include it in the next meeting. So the other thing that I wanted to make sure to talk about today is the awards ceremony that we hosted last year and are going to be hosting again this year. So with the awards that we give out, there's 5 of them altogether, one of which is going to be it will just be taking a look at all the data and awarding to the hospital that has the greatest improvement across the year. We aren't looking at specifically who had the highest reporting or who had the strongest numbers. I think it's more important in this regard to showcase hospitals that have made a real effort to make changes to stuff within their program. But the other 4 are all write-in awards. We have the Innovation and Quality Improvement, the Community Impact, the Outstanding Rural Health Provider, and Outstanding Critical Access Hospital Leadership. All 4 of these you can submit for someone in your hospital or someone at another hospital if there's someone you believe falls into this, or a program that your hospital or another runs that you think would meet one of these specifications. We got a good turnout for this last year, and I would love to see even more submissions this year so that we can continue to showcase the great work that you guys are doing. There's a lot going on in rural Indiana and the rural Midwest in general that is something that should be celebrated. And so we really want to make sure that you have the opportunity to do that. So the applications for it are going to be due to me by April 30th so that we can have the people picked out in time for the critical access hospital convening meeting, which is when they'll be given out. And again, we wanted to point out, because there was a little confusion last year, that you can nominate your hospital or any person in your hospital or somewhere else, anyone that you think falls into one of these 4 categories, you can nominate. Okay, so we've also going to have some benchmarking for the MBQuit measures. This should have gone out on the 15th of this month. It was included with the EDTC graphs that Becky sent via secure email. And what's nice is this benchmarking looks at specifically critical access hospital data, not the whole population. So if you did not receive this or you didn't see it when it came through and you don't want to go digging back through emails, please reach out to one of us and we can forward it through again. But this is a good way to look at your data and see when you stack up to these benchmarks, or maybe start utilizing them in regards to your own measurements, just as a way to have more information and more that you could work towards. We also have another patient experience program coming up. This is another thing that Valiant Health has been putting on for us. The next one is going to be happening on December 12th at 11. We're going to be having Carla Wang from Stratus Health come on and talk about best practices from different top-performing critical access hospitals across the nation. These have been a way to kind of expand on information that we gathered during an HCAHPS targeted focus last year, but we've made sure to kind of expand it to more broadly patient experience in general, because we want to just make sure that you can utilize it in whatever way is going to be useful for your hospital. So these are just some provider surveys, kind of some samples of what this stuff will look like and we could potentially use. And they're just going to be specifically a lot of the different ones. These are all of the measurements, I believe, going through this that we are looking at. So these are going to be included that we're going to be submitting afterwards. You'll receive an email that'll have this attachment so that you can go through and look at these more specifically. I don't want to take time to go through each one point by point, but I wanted to make sure that you knew that it was there and you could see it more closely when you receive the email with this information. Finally, we have an education and networking sessions for our newer quality staff members. So one thing that we realized over the last year or two is just with the amount of turnover that our hospitals experience, there's a lot of times where somebody will come into a position in quality and not have a mentor who can kind of help them, learn the ropes really quickly. I know that this is something that I experienced when I stepped into my role. There's a lot of cases where only one person at a hospital or only a small group at a hospital can really oversee this, just with the staffing concerns that rural hospitals tend to have. And so we wanted to offer some basically kind of a jumping on point for some of these staff members, a way to make this transition a little bit easier. We're going to be having our first session in December on the 19th. And what we're going to be doing is looking at the MBQuip and crosswalk of a couple of other initiatives, talk about some of the quality basics, and look at some important information systems that are good to be aware of. If you're interested in joining this, we're really wanting just newer people to come and experience this. We're worried that if we get, a lot of experienced people on here, the newer people aren't going to feel comfortable asking questions and try to really learn. So this is targeted very specifically at newer people to offer, like I said, like a jumping on point, a place to ask the questions that you might have, and a way to really, have a space that you can discuss these things, because there's a lot of information to learn at a very rapid pace in this position. And we want to make sure that we give the best opportunity for those people to feel comfortable in the role. If you're interested in the session, just reach out to Becky through email, or her phone number is there, so you can give her a call, and she'd be more than happy to give you more specific information about what we'll be looking at on that day. And with that, are there any questions for this that we got sent in or that people would like to ask?
David, this is Becky, and no questions that have come in, but as we've discussed the education for the newer quality person, definitely not to replace the quality education that INAHQ provides, but just feel free to let me know if you would like to join those sessions, and I will get the information to you. And no other questions at this time, David.
Okay. Well, if you do have any other questions that you want to follow up with, you can feel free to reach out to me, to Becky, or to Abby. We're always happy to talk, to listen to any issues that you have, and to answer any questions as best we can.
Okay. And then, David, were you going to share your Simplicity slides?
I sure can. So,
okay.
What we're going to be looking at now, and let me make sure that, is it showing up now?
Yes, it is.
Okay. So the other thing we mentioned, I talked about the EDTC communications information. We have two ways that those can be submitted. One is through a secure email sent to Becky Royer. This is good if Simplicity isn't working for you. We've had some issues with people in firewalls not able to use this information. But if you do have the ability to use Simplicity, it is probably the simplest way. It works a lot like kind of a Dropbox. And I'm going to just kind of run through really quickly what this process looks like. And we'll also be sending out these slides again so that you can have it as a reference, as a walkthrough, especially if you're just learning it or if you were curious about something or something didn't seem to be going right. So Simplicity, like I said, it's a secure file sharing resource that works similar to like a Dropbox, where you'll create the file, drag it into there, and then anyone who has access to that folder can get to it. Typically, the only people that will have access to your specific folder is your hospital and Becky, since she will be gathering the data to send it on up to the federal level. And this is also how Becky can share resources back to you. It's a lot easier than having to send it through secure emails, but it's just as secure. So then, again, the benefit being here that all the reports are going to be in one area, as opposed to you having to like set off a side for it. You can share anyone within your staff can have access to this that you want to give to them. If you want to send this information to other hospitals, this will be just right there for you to go and grab. And you can check to make sure that your reports are there, so that it's not like, oh, I misplace this one or whatever. It all exists in one place. Like I said, everyone has a folder, and if you are wanting to utilize this, you'll get an email from me. It'll just with the subject is I just shared and whatever your hospital name is with you. So once you get that email, you're gonna just click on it. You're gonna create an account. It's going to take you over to the install tab is where you're gonna want to go, and you're just gonna download the program. This is gonna put it onto your computer. You're going to just agree to the terms that show up, run through the simplicity.exe. Once you've used it for the first time, you're going to need to run it manually. It's going to automatically run each time you turn on your computer, though. So you'll boot it up, and it's going to automatically start. Usually you'll find it if you go down to the bottom right corner of your screen. There'll be like the show hidden icons arrow, and that will be where you'll be able to find it. This is what your login is going to look like once it's booted up onto your computer. You'll put in your information that you've gathered, and it's going to, you can set up where you want it to deposit from there. At least at the state level, it's on a shared file that the IT department runs to make sure that everything stays secure. But you can set it up wherever it's going to be most convenient for you. So once you've downloaded it, the client's going to automatically sync whenever new files get added, whether Becky's adding them in, you'll then gain access to them, or if you added one up, Becky will then be able to access them. You can get to it, like I said, clicking on the icon down in your taskbar, or you can set it to be stuck down there if you want to always have access to it. So once you have clicked on the icon, it's going to pull up this that you see right here. From there, you can manage your files. You can look at the recently downloaded ones, or you can browse the files online. The white arrow tab is going to give you a few extra options that enable you to browse the files in the cloud, modify the settings, or just quit out of the program altogether if for some reason you want to close it and then have to pull it back up later. Managing folders is going to pull up everything that you have access to. Your hospital folder should appear in the list. If you go on and you don't see that, that'd be just reach out to us, and we could figure out where in the process something went wrong. But it should just be as simple as double-clicking on whichever folder is yours. So if you do want to use Simplicity, you're going to use it for the EDTC stuff or your computer provider order entry stuff. So it'll let you share that with us at the state level so that we can easily place your documents in the folder that we get, and you can transfer them to us easily. It's going to make the process simpler than being like, okay, I sent you the secure email. Can you check it and make sure everything's in there, and going back and forth through that process. All this stuff is just going to automatically be there, and we should all be able to utilize it. So you can share the entire folder with other people. So what you're going to do is sharing the folders, is you're going to go into the Windows Explorer area of that folder, Simplicity, add to Simplicity. You can also do it down from the taskbar. Clicking on the Simplicity and click on Manage, and you're going to select your folder there, and you can share it out to anybody who's available that you want to have access to it. This will also allow you to, if you go through the browser, you go into Files, you can share the folder out this way as well. Basically, there's a couple of different ways in each case to grant the access to that folder so that the people who need to see it can see it, and the people who need to upload it can get to it easily enough. So if you do have any questions about this process, this was kind of just a brief overview, but it gives you, once you have access to this PowerPoint, it'll let you use it as more of a step-by-step instead of just me running through and clicking it. But the benefit of having Simplicity is just the ability to share the files at a much more rapid pace than having to create a secure email, send it off, and then you not having access to that area. You don't have to worry about, okay, did I store it in the right location? Did I send it to the right person? And all those things, because it's all there, and anyone who has access to it can always go and see it. Is there any questions about this process? It's not sounding like there is. Becky, did you receive any?
No, I did not receive any questions. I will say that for the IU system, I believe the firewalls will not allow use of Simplicity. But if you do have issues, otherwise, why please contact us and we will get those resolved for you. Okay, anything else, David?
I believe that is everything that I had. So if there's not any questions, and again, if you do have questions and you think of them later, feel free to reach out to Becky or myself, and we'll be happy to address them.
All right, thank you. All right. Well, that concludes our program for today. We really appreciate your time, especially as you're trying to catch up after a busy holiday weekend. And have a great rest of your day, and just let us know if there's anything you need. Thank you. Bye-bye.